The issue of pharmaceutical pricing has become a critical concern, with far-reaching consequences for public health and access to essential medications. As the cost of drugs continues to rise, more and more people are finding it increasingly difficult to afford the medications they need, even when their lives depend on them. This growing financial burden is not only an issue for individuals but also for society as a whole, as it threatens to undermine the effectiveness of healthcare systems, particularly in the United States. The rising cost of pharmaceuticals is not just a matter of inflated prices. It is a reflection of deep systemic issues that involve corporate greed, lack of transparency, and economic policies that fail to prioritize public health. One of the most concerning aspects of pharmaceutical pricing is the sheer disparity between the cost of drugs in the US and other countries. In many cases, drugs that are widely available and affordable in other parts of the world are prohibitively expensive in the US. This price discrepancy is a result of several factors, including the lack of price controls, the influence of the pharmaceutical industry in policymaking, and the absence of meaningful competition. While the U.S. government spends billions of dollars on healthcare, much of that money goes toward purchasing overpriced drugs, leaving less for preventive care, treatment for other conditions, or public health initiatives. The lack of regulation in pharmaceutical pricing has led to a situation where drug prices are often set based on what the market can bear, rather than any inherent value of the medicine. This has led to astronomical price hikes for essential drugs, sometimes by as much as 500% or more. For example, the price of insulin, a life-saving medication for people with diabetes, has risen sharply over the years, putting it out of reach for many who need it to survive. Such price increases are not a reflection of innovation or improvements in drug efficacy, but rather a manifestation of the pharmaceutical industry's ability to manipulate the market to its advantage. Pharmaceutical companies often justify high prices by pointing to the cost of research and development, claiming that the funds generated by high drug prices are necessary to fund future innovations. However, this argument is often misleading. The reality is that much of the research that leads to new drugs is funded by public money through government grants and research institutions. Private companies often take advantage of these public investments and then charge exorbitant prices for the resulting drugs. In many cases, the cost of developing a new drug is far lower than the price consumers are ultimately charged. Furthermore, the lack of price transparency in the pharmaceutical industry makes it nearly impossible for consumers to make informed decisions about their healthcare. Patients are often unaware of the true cost of the medications they are prescribed until they go to pick up their prescriptions. Even then, prices can vary widely depending on the pharmacy, insurance coverage, and location. This lack of transparency creates an environment where consumers are forced to pay whatever price is set by the pharmaceutical companies, with little ability to shop around or compare prices. The economic consequences of high drug prices are profound. Many people are forced to make difficult choices between paying for medication and other essential needs, such as food, housing, or utilities. This is particularly true for those who do not have adequate insurance coverage or whose insurance plans have high out-of-pocket costs. People with chronic conditions or complex medical needs are often the most vulnerable, as they require ongoing treatment and medications that can quickly become unaffordable. As a result, many patients are forced to ration their medications, skip doses, or even stop taking them altogether. This can lead to worsening health outcomes, increased hospitalizations, and, in some cases, premature death. The financial strain caused by high pharmaceutical prices also affects healthcare systems. In countries with universal healthcare, governments are often forced to allocate a larger portion of their budgets to cover the rising costs of medications, leaving less for other critical services, such as mental health care, preventive services, and infrastructure improvements. In the U.S., where healthcare is fragmented and access is often tied to employment or insurance status, high drug prices contribute to the overall inefficiency and inequity of the system. Those who are uninsured or underinsured face the greatest barriers to accessing necessary medications, exacerbating existing health disparities and contributing to broader social inequalities. Even for those with insurance, high drug prices can still be a significant burden. Many insurance plans have high deductibles and copays for medications, meaning that patients are often responsible for a large portion of the cost, even if they have coverage. This is particularly problematic for individuals who require specialty drugs, which can cost thousands of dollars a month. As insurance companies and pharmaceutical companies continue to prioritize profit over patient welfare, more people are finding themselves priced out of necessary treatments, forcing them to either forego treatment or rely on cheaper, less effective alternatives. This issue is further compounded by the lack of competition in the pharmaceutical industry. The patent system, which grants exclusive rights to drug manufacturers for a period of time, often results in monopolies for certain drugs. While generic drugs can offer a cheaper alternative, they are not always available for every medication, and the process of bringing a generic drug to market can be slowed by patent extensions, litigation, and regulatory hurdles. This lack of competition allows pharmaceutical companies to maintain high prices for extended periods, even when there is no real innovation or improvement in the drug's formulation. The economic access to medicine has become a crisis that cannot be ignored. The cost of medications is not only a matter of individual hardship, but also a significant drain on the economy, as it contributes to rising healthcare costs and worsens health outcomes across the population. The pharmaceutical industry's pricing practices are a significant factor in this crisis, as they prioritize profits over public health. Until meaningful reforms are implemented, such as price controls, increased transparency, and greater competition in the pharmaceutical market, the economic divide in access to medicine will only continue to grow, leaving millions of people without the care they need to lead healthy lives. The current state of pharmaceutical pricing is not just a problem, it is a public health disaster in the making.